I'm good. All right, it is Monday, June 15th, which also happens to be my son Will's 11th birthday. So while we have a lot to cover, my goal is for us to be in and out in about an hour. Let me start by saying today probably looks a little different if you're watching. That's because we are in the Kentucky Historical Society. Kentucky Historical Society was formed in 1836. It educates and engages the public through Kentucky history in order to confront the challenges of our future. The campus here is in downtown Frankfort. It includes where we are right now, which is the Thomas D. Clark Center for Kentucky History. Built in 1999, it houses the permanent exhibit, A Kentucky Journey, taking visitors on a walk from our native people to the innovation of today. We are standing in the Keeneland Gallery, where temporary exhibitions display artifacts from our past, including the current exhibit on Paul Sawyer, one of Kentucky's most revered artists, who's actually buried just a couple miles from here in Frankfort Cemetery. And finally, you can walk through the popular Hall of Governors, where there are portraits of Kentucky leaders that are on display. You can also leave notes up there, or in the past could, and after COVID again, to leave your thoughts for governors. I remember, I think it was on the day of my inauguration, as we were waiting down here looking at the notes that which was originally part of the property of the Lieutenant Governor's Mansion, which means that from 1984 to 1987, it was a backyard that I played in with my older brother and some of our friends. The Historical Society also includes the Kentucky Old State Capitol, the Kentucky Military History Museum, and Old State Arsenal. Although this center was closed to on-site visitors in March, staff continue to work to help our Kentucky children and everybody through virtual services, through virtual teachings. From Kentucky to the United Arab Emirates, viewers engaged in Kentucky's history and connected during COVID-19. This center reopened on June 8th with plenty of safety measures, and some of the interactive exhibits have been closed for the time being, along with the Old State Capitol and the Kentucky Military History Museum. The library is open for limited capacity throughout the week. So we want to thank the History Center. Our goal has been to highlight some of what downtown Frankfort has to offer and to show people some different parts of their state government. All right, today will be almost entirely on COVID-19, so let's start the way we always start, by knowing we're going to get through this, and we're going to get through it together. So we're going to get through this. We're going to get through this together. We're going to get through this together. We're going to come out the other side. We are going to rebuild and restart our economy. We're going to take care of each other as we're going through this, and I believe we have the opportunity not just to be stronger, but to be better coming out of it. A more compassionate, more just people. We have seen what we are capable of when we come together, and that ought to tell us what our potential is moving forward. So June 15th today, it's not just my son Will's 11th birthday. It is also the last day to request an absentee ballot. The election is 8 days away. Get online. Make sure that you order this. We have had significant numbers of folks get online. Voting is the bedrock of our democracy. Agree, don't agree with a candidate or with an elected official, still vote. It's the way we peacefully transition power. It's the way we make our voices heard. And with all of the various activism or expression that we have seen out there, all of it, I hope, all this energy translates into voting. So today is the last day. Make sure you get online and request that absentee ballot. While you're online, fill out your census. This only happens once every 10 years. It is absolutely critical to funding moving forward. Let's not leave dollars on the table that we Kentuckians are entitled to. These are dollars for critical programs. They're investments from the federal government. It just takes about 2 minutes. So please make sure you do it. Think of them as 2 acts of citizenship, of being a good Kentucky citizen, Number one, voting. Number two, filling out your census. They are easy things that we all can and we should do because we love this Commonwealth and we love this country. All right, today's COVID update is about what we see on other Sundays and Mondays where we have lower numbers of tests coming in, which are lower numbers than we saw, especially at the end of last week. So we're going to go through our report, but then we're going to talk a little bit about what we are seeing in other states. Some people call it an increase, some people call it a spike, and the different steps that are going to be necessary for Kentucky to prevent the same from happening here. So Sunday's report had 85 new cases of COVID-19. That brought our total cases as of Sunday to 12,529, 321 of which were probable and the rest were lab confirmed. 17 came from Jefferson County, 13 Fayette, 12 Warren, 4 in Davis and McCracken, 3 in Shelby, 2 in Clark, Edmondson, Fleming, Graves, Harlan, and Logan, and 1 in Boone, Bourbon, Breathitt, Callaway, Elliott, Franklin, Garrett, Henderson, Laurel, Letcher, Metcalf, Muhlenberg, Ohio, Perry, Pike, Powell, Rowan, Russell, and Union, and 1 was unconfirmed. We also had one of the lowest reports of deaths on Sunday, and we also have a low report today, and we're really thankful for that. We lost 1 additional Kentuckian on Sunday, and 1's too many, but that 1, as of Sunday, put us at 500 deaths in the Commonwealth due to COVID-19. Yeah, as governor, but I think as any citizen of the Commonwealth, you never want to see us lose 500 individuals in the course of really 3 months to this virus. You know, it's a virus that we had never seen. It's a virus that we are actively fighting against. But in that short period of time, taking 500 people, it's devastating. It's awful. And I hope that we can continue to show the compassion to these families and the other families that are going to lose somebody as we move forward. That 1 individual was a 91-year-old woman from Henry County. So in today, we are reporting 120 new cases of COVID-19. That brings our total cases to 12,647, because there were a couple of duplicates from the day before. 321 are probable, the rest are lab confirmed. The 120 cases, which now bring us to 12,647 cases of COVID since the start, are out of a total number of tests that we've now administered of 325,065. If you'd have told me on March the 13th that as we stood here at this point and we would have tested over 325,000 people, I would say, I pray that you're right. But I'm not sure I would have believed it. Our testing capacity continues to increase. We just have to make sure we continue to encourage people to get tested. So as I read out the other numbers, why don't we put up the Kroger way to sign up? Because this week you can do that in Louisville, Lexington, Bowling Green, and Oldham counties. So let's make sure that we get plenty of sign-ups. Bowling Green is Tuesday, Wednesday, Thursday, I believe, of this week. 5 days this week in Fayette and Jefferson. Please sign up. Total number ever hospitalized since the very beginning of this due to COVID, 2,433. Currently, 383. Ever in the ICU, 969. Currently, 63. I don't like to see the numbers that we're seeing, on average now creeping up, though they are certainly not doubling in a way that would suggest a real spike. But the most positive number we have, other than the number recovered, which I'll read in a minute, is our ICU number. It suggests that we are being able to take care of the majority of people that come down with COVID that need to be hospitalized. The current number is 63 in the ICU. Total number of people recovered is our very favorite number, 3,416. Remember, it's artificially low because those are just reports we get back in, and a lot of people aren't going to call you to say I'm better. They're just happy that they're better, and we're happy that they are better. New cases by county: 25 in Fayette, 24 in Jefferson, 15 in Warren, 6 in Shelby, 4 in Bullitt, Clay, 3 in Allen, Davis, Marshall, Henderson, and Woodford, 2 in Callaway, Clark, Logan, McCracken, Monroe, and Scott, and 1 in Barron, Boone, Butler, Franklin, Hopkins, Jessamine, Lewis, Madison, Muhlenberg, Ohio, Pulaski, Rowan, Taylor, and Union, which means we still just have 1 county in Kentucky that hasn't had a reported case, but in Robertson County, there's at least 1 person who's had COVID. I mean, we know that. It's everywhere. We also lost 5 individuals that we are reporting for today. While that number has been lower than in many days we have had, it is 5 too many. Brings our total number of lost to COVID to 505. 2 of those are probable. The rest are lab confirmed. Includes an 83-year-old woman from Fayette, a 47-year-old man from Jefferson. 47. I'm 42. Right now, we don't have a lot of information. He is not a native English speaker, but our understanding is that right now we don't have any comorbidities. We can't identify any long-term health issues, but we hope to have more information moving forward. 82-year-old woman from Warren, 85-year-old woman from Warren, and a 61-year-old woman from Logan County. So that's 6 people between yesterday and today. Lower than many days, but 6 too many. So let's remember, let's keep those green lights on. Regardless of anything else going on out there, this is something that we ought to be able to do together to show compassion to everybody who needs it. My church this Sunday, there was a sermon about Jesus facing the crowds, and the very first thing it says is he faced them with compassion. Now, that's an emotion that we're trying to show, and it's one that these families, 505 of them now, need. Let's continue to ring our bells at 10 a.m. I was given a bell recently that had some deep meaning, and walked out in the Capitol Rotunda this morning, and alongside the employee from the Secretary of State's office who's been doing it every day, rang that bell too. That lets people know that they are not alone at a time which is incredibly difficult. Race and ethnicity of overall cases: 73.39% white, 15.02% black, 6.11% multiracial, 4.84% Asian. On ethnicity, 82.86% non-Hispanic, 17.14% Hispanic. On deaths, 79.41% white, 17.02% black, 1.89% multiracial, 1.68% Asian. And on deaths, 96% non-Hispanic and 4% Hispanic. Again, we see a disparate impact according to race, where COVID-19 is taking significantly more black Kentuckians than they make up of our population. Our goal is to stop that, and our goal is to make sure everybody out there has health care coverage. So if this ever happens in the future, we've all been regularly going to a doctor. Fewer of us have things like diabetes or lung cancer or heart disease, that the next time, hopefully it is another 100 years or more, that we face something like this, we are a healthier people that are regularly seeing our doctors and are in a better opportunity, in a better place to combat this. Now, I will say, to our credit, given all of the pre-existing conditions that we have in Kentucky, given what our death rate is before COVID hit, we are in many ways fortunate that it hasn't taken more, and that's because of a lot of work of a lot of healthcare individuals out there. Long-term care updates. Again, this is an area that has hit probably the hardest. 59 new residents, 19 new staff, 9 new deaths of residents. Again, those 9 have been reported in other days, but that's what's attributable to long-term care facilities. 7 new facilities now have a new case. All right, so I'm going to ask Dr. Stack to come up here in just a second. What we are seeing in many other states, Arizona being right now, I think the most critical example is since reopening, since we have more contacts, some states are starting to actually look like they are spiking, having significant increases day over day, with some of them reporting even cases in the thousands when they had never had them. Our job is to make sure that doesn't happen here. And every healthcare professional right now, and every one of the president's team that was on the news this weekend was saying the one most important thing we can do to prevent a spike, to make our reopening go the way we want it to, is to wear a mask. I know this has somehow become a part of, I think some people call it a cultural war or cultural wars, folks. This is not. This is the key to keeping each other alive. It's the key to keeping our reopening. If you don't think we're reopening fast enough and you're not wearing a mask, you're one of the concerns on why we might not be able to stay reopened. If you want our kids to be back in school as soon as possible and you're not wearing a mask, you could be preventing what it is that you want to see. I know it's not comfortable, but when every single health official, those working for President Trump, those working for me, say this is the very best shot we have, shouldn't we be willing to do it? So this was U.S. Surgeon General was talking about it the other day. Works for, directly selected by the president, is talking about as we reopen, the mask is one of the most critical things. He said, while it's a small inconvenience, it provides big benefits and gives us our best chance for an effective and lasting reopening of America. This is the top doctor in the country saying a mask gives us the best chance for an effective reopening in America. So whether you are an elected official, a leader, whether you're the head of a business, whether you're just going out to the grocery store, if you want to support this state, you want to support this country, and you want us to be able to reopen, please wear a mask. And I want to tell you about mine today. Today, I wear the mask sent to me by David Turner, Jr. David is an 8-year-old boy fighting brain cancer. I met with David before COVID hit. It was on January 23rd. He had come in for a rally at the Capitol that day. He came into my office. He was kind of down. He sat in my chair, pulled up to the governor's desk, and I said, come on, you're governor, for at least 15 seconds. What are you going to do with it? He declared that day National Ice Cream Day in Kentucky. And I remember as we went out to the rotunda for the event, and I brought that up, I looked over at him, and David had a huge smile on his face. Something I'll never forget. It's one of the best moments I've had as governor. His family has kept in touch during COVID, and they've written to me and say this virus is especially scary to them as David is vulnerable. He was already fighting too much, more than any kid should have to, and then COVID hits. His family sent me this mask with a note, and it said, thank you for serving all the people of Kentucky. Make every day the best day ever, which is what they are putting on their masks. I'm willing to wear this mask for my kids. I'm most certainly willing to wear it for David. I think we can all do the same. So with that, I'll ask Dr. Stack to come up.
Thank you very much, Governor. James, could you put the slides up that I have, please? I have two images I'm going to show here tonight and use them to make a point. So in the middle is the website I took these from. It's publicly available. It's 91-DIVIC, which is COVID spelled backwards. In the top left is a graph for Arizona. The top right is a graph for South Carolina. The bottom left is Florida, and the bottom right is Kentucky. These are the new cases by day, 7-day averages, adjusted for population. That's a lot of detail, but just take from this. I picked a 7-day average to smooth the data so that it wasn't as zigzag like ours is, even with the averaging. And what I want to draw your attention to is if you look at all three of these other states, you see a sudden increase. That sudden increase is roughly 30 days ago. It's about the middle of May. That corresponds roughly with when social distancing restrictions were lifted in many of these states. When you have it in one place, you might say that it is just a random occurrence. We have the middle of a desert, we have the southeast of the state, and we have further south in the state in Florida, and then of course Kentucky. If you're hoping that the coronavirus will take a nap during the summer, it's 106 degrees in Phoenix, Arizona today. It kind of suggests that if that kind of heat doesn't slow it down, I'm not sure what kind will. And if you want to look for humidity and heat, it's 89 degrees in Orlando, Florida today, and I think it's pretty humid, at least it has been the times I've been down to Disney World. So we have a disease that when we shut down society, we saw it go dormant and start to go down in many places. You can see that here. That's probably what happened in Florida when they had social distancing, and you see a decline and then a plateau. You see that they never had a huge surge. They had a surge. They were starting the steep part of the curve in South Carolina, and then they had a long plateau, but now you see a sudden spike when people don't fear this disease, don't realize that this is really going to be a bad thing if it gets out of control. And in Kentucky, you see we had the increase, and what I would say is we'd had a very zigzag sort of pattern, but what the governor has described over time, I think, is correct. That's pretty much a plateau if you were to map that and draw a line across it. It's a pretty flat plateau for a long period. I think we've done a good job here in the state containing this and keeping its growth relatively small, but we are at risk, just like everybody else, for that sudden increase if we take our eye off the ball. So James, if you could show the next slide. I picked one of the many slides we've used in the past months to make these points I'm about to make. The tools we have at our disposal have not changed. So I want to remind everyone, there is no vaccine, there is no cure, there is no specific treatment for the coronavirus. There is no vaccine, no treatment, no cure, and what that means is we have to prevent it. And since 100% of the population is susceptible to this infection, except for the few who have already had it, what it means is if it runs through our population very quickly, it overruns the health system. So if you Google and look for news headlines from today, one of the largest health systems, or the largest in Arizona, has been expressing concern that they could run out of ICU beds. And apparently also in Houston, Texas, they are having a surge and talking about if they have to consider activating a field hospital. So this is all the stuff we were talking about through March and April that we successfully blunted in Kentucky. It's all still out there. These are the things that we have available since we don't have a vaccine or medicine specifically to treat it. If you can do stuff outside, do it outside. Definitely have social distancing more than 6 feet. Wear a mask. So I have mine in my pocket here. These little things keep our secretions to ourselves and minimize the spread from someone with infection to someone without. They probably also have some lower value for keeping you from getting other infection. And don't touch or share things, including your hands. We touch our faces, as you've no doubt noticed now as you've tried masking. We touch our faces, eyes, and nose a lot. You have to be very disciplined not to do that. That takes whatever you've touched and injects it straight into your nose or your mouth where you can get the infection and have these problems. So, folks, we've demonstrated we can succeed. We've demonstrated that we can blunt the curve and that we can prevent this from spreading, but it takes a lot of discipline. If we want to get back to our lives as close to normal as we can without having a lot of people get hurt, we got to wear masks, and the governor's going to introduce you here in a minute, Mark Carter, to talk about contact tracing and why that's so important so that we can minimize these intrusions. Thank you.
And there are plenty of masks that are out there. Remember, a cloth mask works fine. Wanted to make sure that our host today, the Kentucky Historical Society, which has also printed some, gets its due. Scott Alvey is here with us, who heads the Historical Society. We appreciate you for making our space available and for making the masks, doing your part. And while the camera never turns around here, I want to also thank the media, which I see not only here, but throughout Kentucky in everything they're doing. modeling that type of behavior with the mask that we need to see. We talked about the media being partners. When we face something like this, that doesn't mean that they can't ask difficult questions, but they're truly showing up and showing the type of example with it that we greatly appreciate. One other kudos, Solutions to Go LLC. That is a company based in Ontario, Canada, but has operations in Louisville. Company officials have donated 52,800 KN95 masks that are going to be distributed to Kentucky healthcare providers. This is a major donation of one of the hardest, it's not an N95, it's the next best thing. It's one of the hardest PPE pieces to find, and it's really going to help the Commonwealth. We appreciate Solutions to Go. To us, you're not Canadian, you're just pure Kentucky. All right, we talked about testing. Let's put up all the different areas where you can be tested. If you get on our website, it's 190 different locations. Make sure you're regularly tested. If you've been to a group with 10 or less, getting together, go get tested. Been to a restaurant in the last 14 days, worth going to get tested. Certainly if you've been in a demonstration, go get tested. If you're just going to work regularly, go get tested. We all want to know whether we have this so we don't spread it to other people. And so if we do, we can prevent it from spreading further. This is a part of our world until there's a vaccine. It doesn't hurt. Sometimes it's uncomfortable, depending on which test you get, but it's necessary to doing it right. So 3 tools to defeat COVID until there's a vaccine. Number 1, social distance. We've talked about that a lot. Number 2 is testing. And number 3 is contact tracing. And we've got Mark Carter here who is heading that up for us to give us an update.
Okay, if I could get my slides up. Thank you, Governor. Contact tracing, as the Governor mentioned, is a tool that our public health professionals have available to them to help stop the spread of COVID to your loved ones, neighbors, and fellow citizens. And it's one of the critical tools that we have, and really the only tool that we have as a public health complex to try to stop the spread of the disease. So I came on board a little over a month ago to try to help with the contact tracing effort, and I want to give you a brief report on where we are. One of the key things is the development of this information system platform. We're calling it the Contact Tracing and Tracking Solution, or CTT. That was stood up in pretty significant or a short period of time for a technology solution. And I don't think this can be underestimated in terms of its value to Kentuckians over the long haul. This is a consistent system that's deployed across the state. It's very flexible. It creates flexibility in terms of assigning contact tracing staff so we can quickly move them if we have an outbreak in a particular area. And they're using the same system. It's like Southwest Airlines flying 737s. Every pilot sees the same flight deck every time he or she gets on a plane. It's secure and it's very cost effective. Essentially, we're using CARES Act money to build this system, and it's going to pay dividends to the Commonwealth for years to come. You can see here that we've onboarded local health departments in 4 waves. We just have a couple of departments left that we have to bring on board. We've essentially used webinar training, and everybody's using Zoom and Microsoft Teams and so forth today to communicate. That's how we're doing the training here, so that we can maintain social distancing for our staff that will be doing the tracing. We have almost 350 users on board, so those are going to be contact tracers, disease investigators, and similar positions that are either employed currently by the local health departments or have been onboarded over the last few weeks. We have a total of 610 local contact tracers or disease investigators on board right now. About 430 of those were in local health departments and had been in place for some time, even before the pandemic. Contact tracing isn't a new approach. It's been used by health departments for decades. But we have 180 new contact tracers that have been onboarded in just a little over 2 weeks. That's, well, I should restate that, a little over 3 weeks. That's a pretty phenomenal rate to bring those folks on board. There's 15 to 20 in the pipeline today. We have over 6,000 applications on the KY COVID-19 website. And so we have a lot of interest in doing contact tracing, and I don't think we'll have any problem filling the 700 or so slots that we have available. Turning our attention to the next slide, one of the most important things here is communication, not just with the public, but with health professionals, constituencies like the Chamber of Commerce, mayors, judge executives, and the like, to get the word out about contact tracing and to make sure people know what it is and what it isn't. Really all we're trying to do here is when we identify someone that's tested positive for COVID, is just to identify the folks that that person has been in contact with recently, and then get in touch with those people and let them know what they can do to protect their own health and to protect their family and friends and loved ones. So the most important thing here is we will have a 1-800 number called Kentucky Trace, which will alert people to the fact that it's the local health department calling them. We just want to continue to get the word out around contact tracing, or the process and the importance of answering the call when you get it and participating fully in the process, just like wearing a mask and social distancing. And then finally, just trying to spread the word in local communities around tracing. A couple of words of caution with all the fraud and spam calls that you get these days. This is a private process. No one will ever ask you for bank account information or credit card or anything like that. If it happens, you need to call the hotline in the Attorney General's office and report that call. But know that you may be asked about your address and who lives with you and things of that nature, but that's just to identify your contacts. The fraudulent stuff with Social Security numbers and bank account information, credit cards, call the Attorney General. And that's my update.
So we have talked about really three major priorities in fighting COVID-19. Number one, the health and safety of Kentuckians. Number two, successfully and safely reopening our economy. And number three, getting our kids back to school. Our Lieutenant Governor and a task force at KDE have been working hard on moving towards that, and she's going to provide an update. This is the Lieutenant Governor, Jacqueline Coleman.
Thank you, Governor, and good evening, Team Kentucky. 3 months ago tomorrow, the Department of Education put together an education continuation task force. At the beginning and the outset of the COVID-19 pandemic, the purpose of this task force was essentially to convene a coalition of groups within K-12 education and work together to get through the challenges that arose during the COVID-19 outbreak. Most importantly, initially, was how do we continue teaching and learning in a non-traditional way? This task force continued to work to support our students and our communities through providing meals across their communities and services to families to basically keep their communities going. Members of this group include a wide variety of our education leaders. We have superintendents, principals, teachers, school board members, the leaders of our regional co-ops, officials from the Cabinet for Health and Family Services, officials from the Kentucky High School Athletic Association, the Department of Public Health, the Southern Regional Education Board, and the Governor's Office. So we have tried to include as many shareholders in the world of public education as possible, because those are ultimately the folks who live where the rubber meets the road and where these guidelines are going to come into play in our public schools. Recently, I invited a bipartisan group of legislators to join our work. I was happy that all four of them accepted, and so joining us is going to be Senators Reggie Thomas and Max Wise, and Representatives Tina Bojanowski and Regina Huff. As this task force continues to evolve, we are working to meet the changing demands of the COVID-19 pandemic, which has shifted from non-traditional instruction in the spring to how do we reopen schools and go back to being healthy at school. So with that shift in focus, at today's meeting, we discussed the 5 best practices that you've heard from public health over and over and over again. And they are wearing masks, practicing social distancing, hand sanitizing and surface sanitizing, temperature checks, and contact tracing. So these are not new items, but what is new is we have to now contemplate, how does this look in a school system? How does this look when there are hundreds and maybe even thousands of students in a building at one time? And that is certainly not going to be an easy feat. But I will tell you this, what the governor has said today, what Dr. Stack just mentioned about wearing a mask, it is going to be imperative that our students and the kids in our communities have positive role models and positive examples to actually practice what we preach. We should never ask of our students what we're not willing to give. And so it's really important for not just our teachers and our education leaders, but our community leaders and our state leaders to follow these guidelines as well. We are working with this task force to create a culture of support around these best practices from the medical community. And the really important aspect of this is taking these safety expectations for our students here that we've determined at the state level and helping to implement that at the local level. That's going to look different in different places. Not every school district is the same size or has the same makeup or anything like that. And so we are working to empower the local community leaders to take these safety expectations and make the best of this situation. So as a reminder, every single school district has a locally elected school board. Every single school building across Kentucky has a locally elected site-based decision-making council, which includes parents, educators, and administrators. And every community has a Department of Public Health. And so we are going to be working together, again, to take these safety expectations for our students and to empower the local communities to be able to implement these for the sake and safety of our students, our faculty and staff, our families, and our communities. It is going to be a difficult lift, and I'm not going to sugarcoat that because we have children who are involved. And so that becomes even more important, obviously, to every one of us. As teachers, we refer to them as our kids, and that's often how we think about them. But if there's a community that can do it, what we saw our public school teachers do and our public schools do in light of COVID-19 in the spring, and how they were able to turn on a dime, adapt their instruction, support their students, not just with curriculum instruction, but with food service and other services that are needed in the community. I know that we're going to be able to do this as we work together. So there will be continued updates coming through. Today, I wanted you to know who is involved in this task force and what we are working towards. And as we continue through the next few weeks, we'll have continued updates on working towards reopening schools and being healthy at school. Thank you.
Well, thank you to the Lieutenant Governor, and she does an amazing job of displaying not just her, but this entire administration's passion for education, especially public education. Let's also make sure that we are always honest and transparent about this virus and who it can harm. And as we work to getting kids back into school, families need to start planning for them coming home from school. Remember that this disease affects especially our seniors and those with heart, lung, or kidney disease. And so for families that have grandparents providing care after school, we may need to look at different options. For parents that have a caregiver that falls into one of those categories, you need to start thinking through it and planning ahead, because unquestionably, as our kids have more contact, just like they will when they're going back to daycare, we need to acknowledge that. And we need to know, just like our schools aren't going to be able to do things in the normal way that we could before, what happens when we come home and how we plan around that is going to need to be thoughtfully considered as we move forward. Last up for questions is Michael Brown. He is the top elected official, the top appointed official in Kentucky. I guess I'm the top elected official in Kentucky. All right, now we sorted that out. But Michael has been, I've been blessed to have him working with me from being the Deputy Attorney General, where we could not have done what we did without him, to now having his counsel in the governor's office. He does a lot of things incredibly well, but one thing that he's always been known for, and he's certainly brought to this administration, is the ability to walk into tough situations and not just to start addressing them, but to stabilize them and even to fix them. So now that I built you up, Michael, you got another thing to fix, right? All right.
Well, thank you, Governor. I'm sure that's more than folks needed. But today's short update will be about the Kentucky Correctional Institution for Women, known pretty much as Pee Wee Valley. And we've had some positive cases of COVID come out there, and I wanted to give a quick update on it. First, good news, no one is hospitalized from KCIW. At the end of May, we received 3 employees tested positive and 11 inmates. So we used what we learned from Green River, and we immediately started not only the mitigation, step up the mitigation efforts which had already been in place, but we, starting last Friday, a mass testing. And to date, we have tested probably a little over 300 as of today. I didn't get today's numbers, but we'll be completely tested at KCIW by the end of this week. We have 639 inmates at KCIW and 228 staff, including contract staff. We've implemented, as I've said, we've got the testing, we've got masks, we've got sanitizers, we even have some foot protection at KCIW. And so learning from Green River is bringing us a long way to get this one. Hopefully won't even reach the levels of Green River. But while I'm talking about Green River, let's talk about how successful those efforts have been. Today we have 1 staff member, as a contract staff member, hospitalized, but of the 417 positive tests that came out of Green River, both inmate and staff, we have 392 that have recovered, meaning that we only have 19 active inmate and 6 active staff cases at Green River. And in the remainder of all our correctional facilities, we have 2 staff and 1 inmates with positive tests. So we are confident that using the methods we've learned with cooperation in Dr. Stack's staff, that we will also bring KCIW under control. Thank you.
All right. We'll move into questions. It looks like today we have Karen Czar, Lawrence Smith, Joe Sonka, Phil Pendleton, and Catherine Collins. We'll start with you, Phil.
Give us a little bit of an update on unemployment as far as the March and April claims. And we understand there's still a lot of people that have not received even their first payment yet. And is there a new holdup with that? Is there a new delay? What's going on with that?
So the most recent numbers is in March, we had 167,420 people file for unemployment. We have processed and we're able to approve 95.48% of them. And there's 7,566 remaining. In April, 429,056 people applied. There are 93.58% of them we got processed, with 27,507 people left. And then May's filings, 295,879. There are still 17,619 people that haven't been approved. That's 94.04% of those thus far. Those were the numbers that I got this morning. We continue to work on new strategies. We have brought new leadership to the table. We are working through some deficiencies, certainly, that were found, but we're also able to bring more people in the labor cabinet that are trained in similar jobs to the table. We're also going to be looking at the potential of outside help too. We have got to not only continue to process these, but we need to move faster. I think we all agree on that. Many people have been waiting far too long, and I'm committed not just to owning it, but when you own it, I think it makes you committed to doing better. Joe?
7 inmates of the Convicted Correctional Institute for Women with the ACLU asking to be freed because they're medically compromised. Do you have any reaction to their lawsuit, and is there going to be any movement to release any more state inmates from prison who are either medically compromised or meet certain status as the type of crimes they were committing?
The question is on the Kentucky Correctional Institute for Women, Pee Wee Valley, which is what we call it. There were 7 individuals who filed a lawsuit. I haven't read the lawsuit yet. I believe they allege they're medically compromised. What we see from Green River is if you were able to test the whole facility and you were able to move those that are medically compromised as quickly as possible, and then take the steps that we took, that you can stabilize a prison. And the fact of Green River, none of the, once we started doing the testing, the medically compromised individuals ultimately contracted the virus. We believe we'll be able to do the same here. Right now, there are not plans for an additional release. We've already released those that were nonviolent, non-sex offenders with a shortened period left on their sentence. But obviously, it's everybody's right to go to the court system, and we will listen to those arguments in court. I've got a couple of written questions. Let me get through one. Will you issue recommendations to school districts on how to reopen and strongly encourage them to do one thing over another, similar to the closure recommendations? Well, we're working on that right now. And what I anticipate, and again, it's where we are right now, is that there are going to be some things that are mandatory, and there are going to be some things that are highly recommended. And the more a school district does of not just the mandatory, but the highly recommended, the safer it becomes. Though we're doing this in COVID-19, there's not going to be a perfectly safe option out there. We know we got to get back to school, and we hope that that our school districts have a high commitment to safety and do everything that they can under both the mandatory and the recommended. Catherine.
Seeing a lot of open appointments at testing sites this week like we did last week, and what can we do, what can be done to fight what you call testing fatigue?
The question is, how are we seeing the same number of openings of non-signups? Can you put Kroger back up just to give people the opportunity, the website on where to go? I don't believe at the beginning of this week, and I'll get you updated information as it goes on. Mondays, there's only 2 of them that are open this Monday, Louisville and Lexington, and Mondays tend to track pretty well. But we are seeing less people sign up the rest of the week, though it's not to a level to where it's still not worthwhile, but we need more people to get tested. And part of that is we need other people encouraging. Now, I'm doing my best, though. There have been days that I haven't encouraged testing, and I should be doing it every single day that I'm up here. You know, we got to test, and continue to test even more. While we are very excited about where our testing numbers are, we can't let them fall off. But we need other people encouraging it too. We need our business owners. We need our principals if you know our teachers are going to be coming back. We need our superintendents talking about it. We need the county judge executives talking to their employees about going in and getting tested so it's not spread around. We need everybody who is in a leadership, a servant leadership role to encourage it, but we need everybody who has a voice out there to say it's my health too. And if those around me don't get tested, then my safety is compromised as well. So we need it pushed and pushed and pushed more. And while we haven't seen a drop-off that threatens reopening yet, we have the capabilities to test so much more. And the more we test, the safer it becomes, because then we can really dig down and see where these outbreaks are and get a better, get our arms around asymptomatic spread better. Karen.
Understanding that this answer could change in a week because it's a fluid situation. As of now, are you anticipating a regular start time to school? And if things do go in an NTI direction to part of it, a lot of the districts have reported that the difficulty is, especially with lower income families, was adequate education on computers, and students started waning off their participation. Has that been discussed?
I don't think that the task force yet has a recommendation for a start and end time at school or a number of days a week or whether or not there's going to be days in and days out. And we know that when kids aren't in that class, the quality of their education is less. That doesn't mean that teachers aren't trying. It doesn't mean that parents aren't trying. It's just an important experience that our kids need. With that said, we're going to have to be flexible. We can't just wish the virus away by simply knowing, and we know what the best learning experience for our kids are. We got to balance that with their health and safety and everybody else's too, and try to come to the best outcome we can. Let's remember, COVID isn't fair. And in many ways, it's the most unfair virus that we have seen because of its impact. It prevents us from doing as many site visits by social workers. It prevents us from it prevented us from having kids in class at the end of last year. It prevents us from seeing our relatives where we want to make sure that they are safe in their long-term care facility. This virus isn't fair at all. And what we can do is the very best we can by trying to allow as many of those experiences as possible while still protecting people's overall health. Lawrence.
Along the same lines, the Department of Education is telling school districts to prepare for intermittent closures. What's your take on that? And is there a concern, again, that opening and closing could compromise education?
I believe that the Kentucky Department of Education is saying for people to prepare for closures. Now, we saw that with the flu in this last school year before COVID. And what we see is that when there's an active virus and you're not doing the right things, one of the quickest way that it spreads is in schools and one of the most effective things when you have a major flu outbreak is to shut down school for a couple of days. So we do need to be prepared. We need to be prepared with NTI because if a school has a major outbreak, you can't continue to ask the students to go in. You got to give it enough time. You got to do the cleaning just like we do in a place of business. And then bring the students back in when we believe that it's safe. So we have to be prepared for that. And in France, we've seen that. Kids went back to school, and a number of the schools had to close and then reopen. I believe it'll depend on the size of the outbreak, what we'll recommend to any superintendent. I mean, at the smallest level could be potentially a class, though potentially a school, hopefully not a school district. But we will be able to be surgical and targeted with our recommendations on that. But yes, we've got to be prepared for that. And we have to be prepared because if we weren't prepared for intermittent school closures during this, then we wouldn't have the resources ready and available to try to do the best we can to make up for that instructional learning. Phil.
I've noticed that as places do reopening or have the reopening, some places are very strict with the rules and other places are not. Where are they getting their guidance from? Is it the COVID-19 website? Is it the health department? Who is telling the businesses, okay, this is what you need to do, this is what you don't need to do?
So the question from Phil is, as we're reopening, he's seeing businesses, some that are strictly following different guidance, others that aren't. Where do they get that guidance? kycovid19.ky.gov has guidance for most industries. The better you follow it, the safer it is. And it is a benefit to your business to follow it. In Arizona, there was just an article about the restaurants, the individual restaurants that have had to shut down due to COVID. You don't want to be on that list. They were all listed there because when there is a massive outbreak, it's really hard to tell people who need to know that they have it without that identification. So those that aren't doing it well, I believe it is a bigger threat to their long-term business. I believe it's not only the right and the moral thing to do to follow the rules as best you can as a person, as a business, as an institution, but it is also the best thing for a business and institution. Joe.
Is there any update on the state general fund budget shortfall and any specific actions that will need to be taken in response to it if there's not additional federal aid to state and local governments?
Question is about the state budget shortfall for the current fiscal year. We have put in action a plan that will balance the budget by the end of the year. It's tough. It won't require massive cuts in this fiscal year because we had extra dollars that were going to flow into next year that we're now going to have to use. But the next fiscal year, if we do not see a federal influx, I mean, our budget's going to be devastated. And I don't see right now, if we don't have federal dollars flowing in, how we come anywhere close to even the conservative dollars that they put into the budget. It is absolutely necessary for the federal government to have another CARES Act that directly helps. It's not just states, it's also local governments. No one's going to make it through this without that. In the interim, they could allow us to use some of the CARES Act money they've already provided to help with those services. That would be helpful, but there isn't a state in this country that can get by without that help.
What date do you need that funding before those cuts have to start happening?
Oh, what we would do is we call in the consensus forecasting group, but that fiscal year doesn't start until July 1. We can still potentially see federal action before then, but we can also get into the month a little bit, certainly, even 2 months in before calling the consensus forecasting group. If we can do that, it is more accurate, and we're already looking at steps that we would take to curb spending until then. It's just like last month, the last reported month, our receipts were a lot better than we expected. Now, they still weren't good, but they were only half as bad as we expected. So if we'd had the consensus forecasting group in, well, they did predict it twice as bad. It would be significantly less accurate moving forward. So we'll be looking at the next couple months and trying to make the best determination of that, but I don't have a decision on that yet. Catherine.
Question for Dr. Stack. I'm wondering
Probably
if
is.
there's been any lessons learned on treatments for coronavirus.
Lessons learned on treatment to the coronavirus. When people start with, hey, this is probably a question for Dr. Stack, it almost always is.
So the question is, are there any lessons learned for treatment with COVID, right? So the lessons learned, I think, are to stick to the science, to not let false hope overtake the science and the pace it can work, and to and then if you follow that guidelines, what we find is chloroquine and hydroxychloroquine have so far not been proven to be beneficial, at least not in any significant way. Remdesivir is still experimental. It's not approved by the FDA for any particular indication, although there are some signs that it is helpful and that patients who receive it get benefit, and we're receiving shipments from the federal government like other states are, and all the hospitals know how to request it, and we've shipped out over 100 doses of that. And other than those, there are other experimental things, but nothing yet that is proven. And as far as vaccines, that's not happening until next year, but the federal government is doing a number of things to take the risk off the vaccine developers so that while they have candidates that are promising, they will assume the financial risk essentially and start producing vaccine before they know they can use it for the whole population. That way, if it is proven to be useful, they have it already ready to start deploying. So I have optimism that our scientists are going to find answers, but it's not going to happen over the next few months probably while we still work through things.
All right. Where do things stand overall as the state proceeds towards gradual reopenings? So right now, we believe we're basically back to a plateau. We will see as the numbers continue to come in. We are not increasing at the rate of those that people talk about spiking, whether you look at Arizona and Texas and some others. And while our numbers kind of go up and down, they are not doubling every day or week or really even 2 weeks and continuing to increase. We still continue to have a lot of ICU beds and enough hospital beds. And so because of that, I think that as of now, our reopening continues, but we're watching it and we're watching it closely. Is there somewhere that lists the daily infection, deaths, and testing totals every day going back to March 6th? We'll get with this reporter to see how we can get them that information. Karen.
I had several calls from some daycares who are a little bit concerned they're getting conflicting information depending on who they call or look. They understand, obviously, if you've had contact or positive to 14 days and all of that. If a child in their care has symptoms but does not test positive, and it could have been a cold or a flu or allergies, should they still wait 14 days before they can let them back in?
They should contact their local health department, and they will work on a case-by-case basis because it could be other things too, to where they shouldn't be coming back in, but they can work with our Department of Public Health. You know, when you've got a child that has shown symptoms that could be COVID, then we want to figure out what the testing was, the accuracy of it, and so I think it's really important when that happens. Call the local health department. They'll work with us. We want to make sure that there isn't just some rule where you do one thing or the other, that we do the right thing for that situation. Lawrence.
Kentucky is one of the states that does not protect LGBTQ people from discrimination in hiring. Given that, your reaction to today's Supreme Court decision, how that might impact the state of Kentucky?
Oh, I think it impacts everywhere. The Supreme Court has ruled, I think rightfully so, that you can't fire someone or deny them housing simply because they're gay. You know, I believe that discrimination in all of its forms is wrong, and we should all be judged by our merit, especially when it applies to work. I think this was a good decision by the Supreme Court. I was happy to see it. It's now the law of the land, and certainly in Kentucky state government, while that has been one of our rules, it's the law, and it's a good decision. And you look at even the makeup of the court in that decision, and it shows you that they did the right thing. They did the right thing. All right, let me finish out with this question. Asking why some tests are coming back non-detected. That is now the terminology that's used for negative. So if somebody gets a test that says non-detected, it's that they did not detect COVID in your test. That could be a little confusing. That's important for everybody to know. All right, so this week we are going to do these updates Monday, today, Tuesday, and Thursday. And so we hope that you will tune in for each of those. I'm going to cut a little short here at the end. It's my son's 11th birthday. He only gets an 11th birthday once, though I hope he has many birthdays after that. To everybody out there, remember, stay safe. There's still a pandemic out there. And please, wear a mask. Whether it's for David, who I talked about today, the other compromised kids and adults around you, or whether it's that you believe Kentucky should be reopened, wearing a mask is what helps us get there. Thank you very much. Thank you, Virginia.